So,
Okay.
welcome to My Nurse Specialty. I'm Rebecca, your host, and today I have a nurse with me, and she's going to introduce herself.
Hi, everyone. I'm Jill Leftwich. I am a rapid response nurse, and I've been doing this for about 6 years. I started as a tele step down in with mostly heart failure patients, and I did that for about 8 years, and then I decided to move on to ICU, which I went into a cardiac ICU, and I did that for about 7 years. And then I got pregnant with my first son and decided that I wanted to kind of step away from the ICU. And I had a coworker who I used to work with, and she did the rapid response team. So she let me know that there was a position available, and I decided to join there. And I've been there ever since. And I joined right before COVID. So I kind of jumped in head first.
So, you mentioned something that we talk a lot about in nursing, and that's like networking. It's a lot of times when you get to a position, it's who you know.
Yes,
So,
absolutely.
you were you like somebody that was interested, and she said, "Oh, you'd be great," or she just out of the blue approached you?
So I knew of the team because, of course, I've used them when I worked on the telemetry unit. But she actually was one of the nurses that trained me in the beginning. And so she knew my, skill and everything. And then when we had so the ICU where I work, the ICU still responds to codes. And I responded to a code one of the days, and she was the rapid response nurse. And so her and I got to chatting, and I was like, I think I would like to do this eventually. And then when I was out on maternity leave, she actually texted me and was like, "Hey, we have a position available if you're still interested." And at the time, I didn't think I would be, ready to do that. But, the more and more I thought about it, and I was like, I think I'm ready and I would like to transition. So I did. And yeah, and anytime we have a position available, we always think of like who would be good for the role and who we used to work with that may be interested, or if anyone, a lot of nurses when we do our rounds, they will tell us like, "Oh, this I would love to do that one day." And so we always keep that in the back of our mind.
Oh, that's great to know.
Yeah.
Nurses need to know that because, that is the way a lot of us move from positions is looking at what other nurses are doing and how do I get there?
Yeah.
So for those who don't know what a rapid response nurse is, tell us what a typical day looks like and what it actually is.
So we start our day, we actually overlap the nurses' shifts. So we start from 6 to 6 instead of 7 to 7. So that way, because we were finding that a lot of rapid responses were getting called that early, right at change of shifts. So it was nice that we didn't have to leave at the same time they did. So we'll come in and get, we don't have to do a full report, which is kind of nice because, we don't have to necessarily see the patients again, but we will give a little report from the previous shift. And then often we will round on each unit and kind of get an idea of anybody that may be unstable or may be questionable. And the nurses can always bounce ideas off of us, ask us any questions. And then, it's just kind of like a fly by the seat of your pants type of job where you just wait for a call and you go and respond, and then you handle that situation, and then you move on to the next one. And some days there's none and some days there's 15. So you just never know. It's kind
And
of a job where you have to take it day by day, and you have to be okay with not having stuff to do always to do, and then also being continuously busy from the start of your shift to the end of your shift.
so downtime, what does like downtime look
Yeah.
like? The,
So we try to stay busy by, rounding and being active in the hospital and on the floors. And the nurses can always call us for any situation that they have, even if they have a new device that they've never seen before, or, they have a chest tube and they really aren't that familiar with chest tubes. We'll go and do some education. And we're actually working on doing more education throughout the hospital because as many probably realize, is that a lot of experienced nurses have left the bedside, and leaving the floor nurses to have, not as many seasoned nurses to rely on. So we are becoming more and more of a resource for them. So we are working on doing more consistent education as well. And then downtime, other than that, you just kind of have to keep yourself occupied.
yeah, that's great that you're a resource nurse for those nurses because they really do need someone that's seasoned and knows, what to help them with and can answer some of their questions. So, what misconceptions do you think nurses have about this specialty?
So this is a misconception that I had going into it was that there is no downtime. That you are busy from the start of your shift to the end of your shift and that you're going from emergency to emergency, which is not always the case, and it's actually not the case most of the time. I would say on average we have about 3 or 4 a day, but like I said, there's many days where we don't have any, and you kind of have to occupy your time, on your own, and you don't have that regimented, like I have to do these tasks for the day like you do at the bedside. And I think that can be a big change for a lot of people, especially coming from the ICU where you are often busy from the start of your shift to the end of your shift. And having that downtime, and especially ICU nurses, I feel like we don't like downtime often. So it can be a big change in that sense. And then I think a misconception is that we take over the patient, and that's actually not the case. Is that we are there to collaborate with the bedside team and to assist them, but we are not there to be the primary nurse and take over completely. We don't leave the patient until the patient is stable or until they transfer to another like higher level of care. But I think often nurses assume that I'm there to like relieve them of their duty, and that's not the case.
So, kind of describe like what it would happen if somebody calls your team.
Sure. So, we get the call over our phone and we show up, and we I kind of take a step back. I just kind of assess the situation and see like how urgent is it in the moment, and do I need to start actively, intervening very quickly, or can I kind of step back and let the bedside nurses do a little bit more helping me, and just kind of see like how urgent the situation is. And then from there, I can gather as much information as I can based on the situation and how much time that I have. And then we kind of collaborate with, so on my team, there is a nurse, a respiratory therapist, and a physician. And then we kind of all collaborate together to see what's the best treatment for this patient. And obviously, if it's urgent, we're just kind of jumping in and taking care of the ABCs. That's I always go back to that for the nurses because they often will ask me like, "Well, I don't know what to do." And that's what you do. You start with ABCs. Once you know that those are stable, then we can kind of take the time to gather more information and like I said, kind of learn more about the patient instead of just jumping in and intervening. But, we always have to take it case by case.
Right. And then sometimes when, you panic and,
Mm-hmm.
it's good to take a breath and remember, the ABCs and start from there. And
Yeah.
so that's good to know that. Now, these jobs aren't like in your kind of specialty, isn't in every hospital, more like
Right.
bigger hospitals. Is that right?
Some have tried it, but because they're not being utilized as often when it's a smaller hospital, I think a lot of them have gotten rid of it, and they have a team still, but like the bedside nurse or the rapid response nurse still has her own assignment in the ICU. So there is a team that they can call just like any code team, but it that's not the nurse's primary job.
So a nurse who was like part of a code team, if she wanted to find like a position in a hospital where it's just part of that team, that would be a good transition.
Yes. If you've ever responded to emergencies, then I think this is a great job if it's something you want to have a little more downtime and maybe not be as busy with one-on-one bedside care anymore. This job is a great job. I actually like most of the people on my team, like we just think like it's kind of crazy that this is our job because it is the best of both worlds. We get to come in and do the things that all we all love to do as an ICU nurse, and then kind of step back and not have to do all of the everyday in and out things. And then we also, a lot of us do love teaching, and I think that's a big part of it as well.
So what do you wish you knew before you started this position?
So one thing that, and this I tell people who are interested in this role all the time, is that you have to feel very comfortable in an emergency situation as if you were by yourself. because often when we are coming into the situation now where I work, it's residents that we're dealing with, mostly medical residents. So they are also inexperienced. And sometimes you are the most experienced person in the room. And you often have to guide the room and kind of go through and obviously staying within your scope, but you are often the only person that may have seen this current situation ever in their career or know the correct steps to take. And you kind of have to know your role as far as guiding everyone in the room. And when you're in the ICU, if you have an emergency, you have four other nurses, depending on how many nurses you work with. Your whole floor could come in and help you, and you don't have to delegate tasks because everyone kind of just comes in and assesses the situation and picks a role to do. Whereas when you're on the floor, you come in as the nurse, you know all the roles that need to be done, but the people that are coming in often don't. And you have to think of what needs to be done, also delegate the things that think of what can be delegated, and then also delegate those things all at the same time. And that can be very overwhelming in the beginning. And that was definitely something that was a learning curve for me, even having 7 years in the ICU and being very comfortable in codes in the ICU. That was the toughest part for me. And I
Okay.
think sometimes too, like as we've had some nurses that have come and have had minimal, we require 2 years at least from the ICU experience. And we've had nurses who've had 2 years and they struggled a little bit because of that. They're so used to being told what needs to be done and what they need to do that they don't always know how to know what to do off of the top of their head, if that makes
So
sense.
so it's a team, but at the same time, you have a leadership role
Yes.
and you have to be autonomous in that role
Yes.
because wherever you're called to, you're the one that's taking that lead.
Yes. And I think you have to have that calmness about you because you're walking into a chaotic situation. So you can't come in also with adding to the chaos. You have to almost kind of set the temperature of the room because often people are panicking and they're running around and they don't know what to do. So they just start it just gets very chaotic and you have to kind of walk in and be like, okay, everyone needs to take a deep breath. We're okay. You do this, you do that, and kind of lead in that sense as well, because like I said, you're often the only one in the room that knows what to do.
Right. Yes. Even nurses with a lot of experience,
Mhm.
sometimes when that happens, they can panic and
Yes.
you're like the calm, reassuring person when you show up. Oh, she's here. So,
Yeah.
and then can take over and help them go from there.
Yeah. Yeah, so if you find yourself in the ICU still a little bit panicking, I think you just need to give it a little more time in the ICU until you feel that sense of like I could walk in and help in any situation and feel comfortable and calm. I think that's when you can move on to this role because like I said, you are that like like guiding light for the nurses at the bedside a lot of times. And a lot of times we will hear from them when we show up, oh, thank goodness you're here, or I'm so glad to see you. And you can almost instantly feel that sense of like relief for them and that like that they can take a deep breath now and not feel that panicky situation in themselves.
It's good for them to see you and then also call on you when they're not having an emergency to ask you a question.
Yes.
So that's good.
Yeah, I do find that when they use us in that way, it does build that rapport better too, because then they aren't in that panicky situation and we can actually talk through things and they can realize that like I'm here to help you. Like, because sometimes you do walk into a emergency situation and it is very chaotic and you do have to kind of put on your mom voice in a way and like kind of control the room. And sometimes that can come across as you're not being the nicest. But in that situation, I don't have I can't be the nice one and necessarily. I have to be a little bit more assertive and until the patient is stable. And then they'll find that like once the patient's stable, I'll talk them through the whole situation and this is why we did this. And and if I do feel like I was ever being too assertive or too aggressive, I always try to like talk to them afterwards and be like, I'm really sorry if you felt that way, or if I came across this way, I just was really nervous about the patient, or, taking that accountability, I think is a big thing too.
Right. And it sounds like you do definitely do a debriefing afterwards.
For the most part, we try. For rapid responses, it's a little more difficult because people tend to disperse very quickly. It's like as soon as the patient is stabilized, it's like I have my own work to do, so I have to get back
Mhm.
to that. As far as like, because the physicians still are coming out of the ICU so they have patients that they're seeing in the ICU, and same thing with the respiratory therapist. So it's hard to keep them at the bedside sometimes to debrief, but we always, as the nurses, debrief with the bedside nurse and any other nurses that are still around because I always find it's a great learning opportunity.
Right. And so important because that's what we'll hear a lot about, that that isn't done often enough.
Hmm.
And to be able to do that, especially for a nurse who's having this happen, like, still so early on and having that panicky sense and then finally getting through it and you guiding them and helping them to be able to process that at the end is probably very valuable for them.
Yeah, I mean, I know I find it valuable too, because even just hearing what they're struggling with or why they didn't do something, or maybe, like if I ask them a question and they don't quite know the answer, that helps guide me for the next one as well, because it's like I know where I can help the nurses more, where I see the lack and where I see the struggles. And with the debriefing, that's where you put the pieces together. That's where
Right.
in the moment you're doing all the tasks. But then when you realize why you're doing the tasks, that helps you for the next time to understand. Because I often hear from nurses all the time, like, what do I need to do? What should I do to, I don't know where to start. I don't know. But when you debrief, that helps you learn for the next one where to start.
Hmm.
And if you ever see a similar situation again, you'll know this is why we did it, and this is why we chose that treatment, and this is why we, started with this, and et cetera. Because that just, I think a lot of new nurses are very task oriented and they're very learning to just get through their day. But once you start to understand why you do things and what the process is, that's when you become that confident nurse, because that's when you can start to like think outside the box and you don't need someone to tell you what to do. You already anticipate what's going to be ordered or what needs to be done.
Right. Well, that's great, valuable information that you're sharing. Tell me for like growth, because I always like to talk about a nurse starts wherever she started, ICU or a code team, and ends up on the rapid response team. What would be the next level if, even though you're happy what you're doing, maybe a few years from now, you want to grow? Is there growth within this specialty, or what would be like a next natural step of where to go?
I think education would be a big one for a lot of us. There's quite a few of us who are in nurse practitioner school or getting their master's in education. This helps with that, like initiating whether or not you like teaching, and that if this is something you're passionate about, it kind of can ignite that for you. And then a lot, like I said, a couple of our nurses have gone back for masters in education and they're either clinical instructors or they're becoming professors. I think that's a good growth like step there. I
Mhm.
mean, management probably would be a next one, or even like a clinical nurse specialist or educator on the floors and things. Because we kind of are doing that in a way, helping
Yes,
the
it
educators.
seems like, and education does seem like a natural step. So that's
Yeah.
good.
Yeah, like I think personally, if I was going to move on, that's where I would head towards.
Excellent. So, what advice would you give to a nurse that is wanting to do this?
So I think it depends on where you're at currently in your career, but if you do not have ICU experience, that would be my next step, is to go to an ICU that I would say a more maybe like a medical, it depends because where I work, our ICUs are split up into specialties. So I think if you have a hospital like that, I would suggest going into like a more general ICU or like a medical ICU or even cardiac ICU. I think you get a good general overview of everything because while even if you do like a neuro ICU, you can still do this role. You're not seeing that like as much of the all of the things. And you never know what type of patient you're going to walk into. So having that more general ICU experience, I think is valuable. And like I said, just finding out how much time is required on your ICU or for your rapid response team of how much ICU experience you're required. I think, like I said, we have 2 years experience requirement. I honestly think that it should be a little bit higher, but it all depends on the person. We've had people that have had 2 years and done fine, and then we've had people that have 2 years and it wasn't for them yet. So I just, like I said before, I think just your comfort level in emergency situations when you have to think about you don't have your coworkers to rely on that you do in the ICU. So even though you have your 2 years under your belt, think of that with whether or not you feel like you could handle this without them.
Yeah, and you bring up a point too. Even sometimes when you think there's something that you want to do and you're going towards that, but then you're actually in it. You don't always know until you're really actually doing it, and then that's when you can make the decision whether you're staying or going. And it's okay if you decide it's
Yeah.
not for you as well.
Right. Yeah, like we just had someone who, he came and I think it really wasn't for him yet. He's still on a newer nurse, and I do think that I find newer nurses tend to not want to do this role just yet because it's more of a job where you've done the bedside work and you've gotten your experience in there and you've kind of learned a lot of the most of what you're going to learn. You're always learning in nursing, but, you know, I think the majority of what you're going to learn, you've kind of gotten under your belt. And then coming to this role, it's kind of, you can be that ancillary person, but if you still really want to learn a lot, I think staying in the ICU a little bit longer is probably a better fit. And then once you feel like you've gotten the majority of it, then then I think this is a good role to transition into. If you love emergencies and codes and rapid responses, I this is an awesome job and I love it. I don't know that I would have gotten through COVID if I was still at the bedside in the ICU, to be honest. I every day I think to myself, I can't believe that this is my job because, you go from being so overwhelmed sometimes to having to be able to step back. But I've also done this for 20 years, so I feel like I've deserved that time or earned that time to take that step back too. But I still love the emergencies and I still love that adrenaline, that you get. So I think like I've thought about going to maybe like an outpatient setting or something like that, and I just never thought that would be too boring for me.
Yeah,
So,
you got to know what,
yeah.
works for what you like from your experience, what you've been doing, what you've learned, and experience is just so valuable.
Yes, exactly. And know yourself, know what you like and what you are drawn to. And, even if anyone is listening from nursing school, like what speaks to you when you're learning the different diagnoses and things in school, like, because that's how I got started in my career. I thought I wanted to do pediatrics. And then when I was in nursing school, cardiac really stood out to me and it really made sense to me. And it was something that I was really drawn to. So I decided to go that path. And that's what led me to where I am now. And so I think just really listening to your intuition and knowing like what really, not don't just do what everyone else is doing or what you think that you should be doing. Because if I would have done that, I probably would still be in the ICU because I I felt like I was stepping away from bedside nursing, and that was always where my heart was. But I still get that in this role, but it's not the sole part of the role. And I do love teaching, so I've realized that my passion is kind of shifting a little bit, and that's okay too. And that's what's great about nursing is there's so many different roles that you can do and shift to. And like you said, if you don't like it, you could try, and a lot of times you can go back to what you were doing before. So
Right,
you're
right.
never kind of stuck, even though I think people often think that they're stuck, but nursing is one of those careers that I feel like you're never really stuck. There's so many different avenues you could try.
Right. We're kind of like in a unique club when you become a nurse, right? Because
Yes.
you can do those other jobs outside of nursing, but you're the only one that can do the jobs in
Yes.
nursing. And there's
Definitely.
so
Yeah.
many jobs in nursing and so many roles that you can do and so many areas that you can look into.
Yes. Yes. That's what I love about it. And it can
Yeah.
be fun. Like if you're not having fun at work and you're not enjoying your work, that's my cue to move on. When I started, when I started to like kind of dread coming to work, I felt like, okay, I think it's time for me to go. Like that's when I realized that I got enough out of the job that I was in and it was time to go on. It wasn't that I didn't like nursing. It was just that I was getting complacent where I was.
Right.
And so,
Yeah. I've always said that. I've always known it was when it was time to leave.
yes, yeah. And that's
So
okay. And
yeah, it's okay.
yeah,
There's other
I
things you can
think,
do.
yeah, I think in nursing, sometimes we can, I don't want to say shame, but sometimes we look down on not being a bedside nurse or
Mhm.
like you're not a real nurse if you're not a bedside nurse.
Right.
And
You'll lose your skills. We'll hear
yeah,
that.
exactly.
Yeah.
It's like riding a bike.
Right.
You
And
might
a
need
lot
a
of nurses have
refresher,
gone back.
but
Hmm.
it comes back to you if you've done it long enough. And yeah, I think,
Right.
and you know what? Even if you lose those skills, you might not need them anymore.
Right. Right. But like I said, you said it's like riding a bike. I don't think you lose them. You just tuck them away and then you just
Yeah,
need a refresher and then you can do it.
right.
So
Yeah,
a lot of still options.
yeah,
So
exactly.
thank you so much, Joe. You've given so much information on this specialty, and nurses will appreciate knowing about this different area of nursing they can go into. And you do other things too, right? Resource to help nurses, right?
Yes. So I started a TikTok channel and an Instagram channel. It's been about a year now. And I started out, I wanted to educate nurses because, like I had mentioned before, just I felt like the experience at the bedside was really lacking. And I saw that a lot during COVID and walking in. And when I became a rapid response nurse, I'm walking into these situations where I realized that a lot of the bedside nurses were not getting the experience that I did as a new nurse. And having those seasoned nurses guide them and be able to help them and walk them through things. And they were calling us more and more about things that I thought like, well, don't you learn that in your from your preceptor, or don't you learn that from working on the floor? But you don't if you don't have those people that can help you. So I started the channel to kind of give them that resource, and I started my own online program to kind of walk them through rapid responses and educating them on what they need to know and how to get through a rapid response, because I found that a lot of nurses were either felt like they were frozen in the moment, or they would leave the room because they felt like they didn't know what to do or couldn't handle it, or that they didn't need to be there. And I felt like that was really something that was lacking. And a lot of people have reached out to me on social media saying that those things that, they just don't know what to do. They were never taught what to do. And then they feel they have some of them have said like on their floors the culture is that if you ask questions you're kind of made fun of or you're shamed for asking questions. And I'm like, that is the key to nursing. That is
Right.
the ultimate, like, how are you supposed to learn if you don't ask questions? So I wanted them to have a safe space that they could come to and not feel judged and have someone that has the experience that they could learn from. And we often get this nurses eat their young mentality of nursing. And while we can be tough, like I said, when I walk into a rapid response, sometimes I can be a little bit assertive and tough, but it's because I want what's best for you and the patient. And but I also want to be able to take you under my wing and show you that like nursing can be great. Nursing can be fun. Nursing is so rewarding and there's so much to learn. You'll never learn it all and you always will need help. And I wanted them to have someone to be able to come to for that help.
Yes, no, I see it all the time. I actually, I'm in that group too with the nurses that are early career. And you're right, they are scared to ask the questions, mostly because they get shamed when they're
Hmm.
asking. And so they don't, you get a thing like, well, you're a nurse, don't you know? And we really need to support as much as possible. So I think that's absolutely great that you have that channel that you started, especially nurses. We're learning everything, but we don't have the opportunity to be in codes on the floor as a student.
Right.
Usually they're not even allowing you in. You're the extra person in there. So they're kind of, pushing you out and not
Hmm.
having you observe the code. So now you're the nurse and you have to be involved and you do have a lot of questions. And I think that's great that you have that resource for them. So how can people find you?
So I'm nurse.lefty on Instagram, and I am revitalizing nurses, all one word, on TikTok, and revitalizingnurses.com is my website.
Okay.
But so thank you so much for this opportunity. It's been great talking to you.
Thank you so much for
Yeah.
coming on. Thank you for sharing your story and what you do. And I love the resources that you're providing for nurses.
Thank you so much.
I hope what you heard today gave you real insight into this specialty and helped you see what's possible for your nursing path. Please subscribe so you don't miss what's next. And tell me, what specialty should we feature next? If you're a nurse in a unique specialty that you'd love to share, apply to be a guest on my website. I'm Coach Rebecca. Until next time, keep exploring.